My name is Carly Soule, and I'm going to be having a conversation with Senator Katrina Robinson, who is a registered nurse. Hello, Senator Robinson. It's nice to meet with you today, and I wanted to thank you for taking time out of your day to meet with me. My name is Carly Soule, and I am the Chief Advocacy Officer at Tennessee Nurses Association, and am a registered nurse in the state of Tennessee.
Hello, Carly. It's nice to meet with you as well. So, what brings you in for this meeting today?
In Tennessee, end-of-life patients are having conversations with healthcare providers every day regarding treatment plans, many of which are not aware of what the information provided actually means or if they are receiving all pertinent information. Nurses witness these conversations daily without the ability to say much on the matter, as it is the responsibility of the healthcare provider. These conversations can lead to a variety of emotions and uncertainty for end-of-life patients, which is why I would like to talk to you about advocating for a mental health professional's involvement in these conversations.
A registered nurse and a chief advocacy officer. Sounds like you stay pretty busy. As a nurse in the state of Tennessee, I've seen my fair share of conversations with end-of-life patients, and I've considered how lost this may leave the patient in the moment. How are these conversations currently being handled?
From what I have witnessed as a bedside nurse, care conferences are had between the healthcare team and the patient, but family or an advocate isn't always present, and nursing staff is not always able to be present, leaving a disconnect in the understanding.
Wow, I have seen these situations unfold, but I guess I haven't really thought of it from this perspective.
That seems to be the issue, which is why I want to present you with my idea of implementing a requirement that a mental health professional be present in any and all end-of-life conversations. I believe this would be a huge support for these patients and would reduce uncertainty, assist in emotional processing, and be a huge benefit to this population in the state of Tennessee.
Great. Can you give me a bit of a refresh on the Tennessee Nurses Association just so I can have some background before we continue?
Of course, the Tennessee Nurses Association works to be the professional voice for all registered nurses in the state, and with that, it is our duty to advocate for and protect our nurses and our population. Our goals within the Tennessee Nurses Association are to advance the nursing profession, improve health and healthcare in the state of Tennessee, and build up and encourage nursing leaders.
This helps provide some background. Now, Curly, as a nurse, I'm curious why it is so important to you to have mental health professionals present in all conversations regarding end-of-life patients.
So, my grandmother was recently diagnosed with metastatic multiple myeloma. Upon diagnosis, they started to provide treatment, but a month or so in, she became very sick and very weak, and it was apparent that she was not tolerating the treatments well. At one of her many hospital admissions, the doctor for her service told her and my aunt that she would be better off going home on hospice, as there was not much more the hospital admissions would do. Though they said that, they did not provide her with clarity on how long she had or what this process would look like, and they were of no assistance in finding hospice care for her. My grandmother returned home and the family set up hospice care for her, but the entire time she still thought she was going to be okay and would eventually continue treatments for her cancer. When a hospice nurse finally explained how grim and short her prognosis was, she became very depressed and would not cope with that reality. My grandmother had no access to counseling services through hospice and had no one beyond family to discuss everything the last few months had brought, or all of the preconceived notions she thought she understood. Her life progressed quickly and led to her eventual passing, but even at that time she had no way of dealing with all of the uncertainty or emotions that this process had sparked.
So essentially what you're saying is because of the lack of mental health resources available to your grandmother, she experienced supplemental suffering through the end-of-life process.
Yeah, that's exactly it. From my personal experience of watching this reality play out for my grandmother, as well as at work daily, I think that having a mental health professional in all end-of-life conversations would maintain a sense of understanding through the process and would be an excellent resource for this population.
You make a good point, and as a nurse I can relate with what you've brought up after staying at the bedside a time or two myself. So why do you as a member of the Tennessee Nurses Association feel that a nursing requirement for all mental health professionals in the end-of-life conversations is the best option?
Through my own observations and experiences and research on the end-of-life population and these conversations in general, this resource being available to them would provide not only an advocate if they do not have family or friends to be that, but would also allow them someone to talk through and process the information with. This would provide a greater understanding and less uncertainty through this time. Emotions will be better supported, and families and families at the end of life patient will be at peace in a very trying circumstance.
These are all very good points you made, Carly.
Thank you, Senator Robinson. This is why I'm hoping that as a fellow nurse working in the same profession and understanding these same circumstances, that you will consider advocating for the requirement of a mental health professional in all end-of-life conversations.
So why does the Tennessee Nurses Association exactly want to advocate for this resource and take on this work?
As the organization that works to provide a voice for the nurses within the state of Tennessee, it is our responsibility to recognize where our state falls short as far as nursing advancement and what we can do to fix that. In assessing these things, our organization has noted that this is a major topic of concern for nurses in our state and the well-being of the end-of-life population, which is why we would like to help advocate for this resource.
So, Carly, if I were to bring this forth in our next Senate meeting, would your organization be able to provide all the necessary details I might need and everything I'd need to push it forward?
Absolutely. Tennessee Nurses Association would love to help you bring this idea forward and make the subject known to our legislators so that the eventual requirement of a mental health professional in end-of-life conversations can be considered for our state.
Well, Carly, I appreciate you bringing this topic to me. As a fellow nurse, I can definitely relate to what we've discussed and would love to see this idea move further if we can get it done.
Thank you so much, Senator Robinson, for your time and for supporting the Tennessee Nurses Association desire to have a mental health resource available in end-of-life conversations. I will leave you with my ask, and if you have any further questions or need any other information, please don't hesitate to call. All my information is on that sheet, and I look forward to hearing from you again soon.
Thank you.